Hello and welcome to the week with me, Puja Awasthi. This is episode 6 of Undoctored. Undoctored is a space where the experts speak your language on all matters health. Our expert today is Dr. Nitin Sardana, who is the Associate Clinical Director of Minimally Invasive and General Surgery at the Marengo Asia Hospital at Faridabad. Welcome to the week, Dr. Sardana.
Hi, ma'am. Thank you for welcoming me, and I'm pleased to have this conversation with you.
Thank you so much. So, if you could just start by telling us in very layman terms, what exactly is minimally invasive surgery?
So the minimal invasive surgery or the minimal access surgeries, they are the surgeries which use small incisions, and we use a laparoscope and a small set of instruments to operate on a patient. Previously, surgery used to be conventional, like open surgeries. There used to be big cuts, incisions over the abdomen or any part of the body. But now, with the advent of the minimal invasive surgeries, we use small cuts and do the surgery laparoscopically.
Right. So, can this surgery be performed for any kind of issue? Is this a broad spectrum surgery or is it limited to certain uses?
So, with the advent of technologies, now these surgeries are performed for mostly the abdominal surgeries, those surgeries which used to be performed by open technique. Now they are being performed laparoscopically. And again, with the advent of this thorax, like chest surgeries, now they are also being performed laparoscopically, like with minimal access approach. And there are some other surgeries like now with the advent of this, laser surgeries are also there. So I would like to make a point, laser and the laparoscopic surgeries, they are a bit different. Both are a spectrum of minimal invasive surgeries. Laser is the source of energy. So for some surgeries we use laser, but don't get it confused with the laparoscopic or the minimal access surgeries.
Right. So just to understand, what exactly does a laser do, and how is it
Okay.
different from minimally
Now,
invasive?
laser is a source of energy. Now, we are using it for, like, I am a general and a laparoscopic surgeon. In my field, we are using it for hemorrhoids like piles, fissure, fistulas, anorectal disorders, and varicose veins. You must have heard there are prominent veins in the leg. So, we are using laser for those surgeries. Earlier, there used to be cuts, and the surgeries used to be very painful, like for hemorrhoids and all. Now we are using laser technique. There are no cuts involved. The tissues are just being burned, and the patient is disease free within a few days.
Right.
So, and and again, lasers are of different types. Again, they can be used in like kidney stones or the ureteric stones. There also the laser is being used. So, laser is a source of energy. It's a uh, part of a minimal access thing, but it's a source of energy. And minimal access means any surgery which avoids bigger cuts.
Right. So, is there any kind of issues for which such surgeries are not being used at present?
See, coming to the minimal access or the laparoscopic surgeries, they usually require a general anesthesia. Patient needs to be under complete anesthesia. So the patients who are unfit for the general anesthesia, they are not the candidates for the laparoscopic surgeries. And if there are some previous surgeries which leads to intra-abdominal adhesions, like the tissues, they get stuck with each other, and we need space for working.
Right.
In laparoscopic surgeries, there has to be space, which is created by carbon dioxide gas, which we use to insufflate the cavity, and then we operate. So, because of some previous surgeries, there can be issues in laparoscopic or the minimal access surgeries. So, only those patients or some cardiac patients, respiratory chest patients who have a poor respiratory reserve, who cannot tolerate general anesthesia, they are not the candidates for general this laparoscopic surgeries. They open surgery or the conventional surgery is a safer option for them.
Right. And is there any age bar that you consider while performing these surgeries?
Definitely. See, now with we have smaller micro instruments also, so we can start this laparoscopic surgery even in kids, starting from age group of 2, 3 years, and even in the old age, if the patient is fit enough to tolerate general anesthesia and the laparoscopic surgeries, he can be operated, he or she can be operated with this minimal access surgery. So there is no as such any age bar for this. So starting from childhood to the old age, we can do these surgeries.
Right. So, one thing, of course, you said is that the incision is very small, or in the case of laser surgeries, you are not making an incision at all. So, this leads to various advantages. So, could you elaborate a little on those?
See, with the smaller incisions, the post-op recovery, like the post-operative pain. Earlier, there used to be bigger cuts for, say, example, gallbladder surgeries. There used to be big cut in the right upper abdomen. Patient used to be bedridden for a week, 2 weeks, and they couldn't even move properly. Now, with laparoscopic surgeries, there are either one hole, there is a single incision laparoscopic surgery also, or at the max 3 to 4 small cuts, which vary from 5 millimeter to 10 millimeter. So with that, the patient is ambulated, means he or she can walk by evening itself. Like in the daytime we operate, by evening the patient is out of bed. Pain is within limits, and again, the post-operative scar, that is also an issue with young patients. At least they are worried about the scar also. So that is also very less. And again, the blood loss, like with
Right.
open and bigger cuts, there is more blood loss and post-operative weakness and all those issues were there. They are also very less. So the patients get back to their routine very early, and there is means benefit of definitely all these things.
So, when we talk about cost factors, you did say that hospital stay would become much lesser in these kind of surgeries. But the surgery itself, when compared to conventional surgery, how does it compare cost wise?
See, now nowadays the laparoscopic surgery has been there for say around 30 years in India now, more around roundabout. So the costs they have become comparable to the open surgery. There are no additional costs for performing these surgeries. Now it's considered as a part of what means surgical spectrum. Like we have instruments for the open surgery, so we need to have the setup and the instruments for the laparoscopic surgery. So the costs have become comparable, and there are no added costs except the type of surgery which is being performed that can add to the means say if there is some intra-abdominal adhesions, like some special instrument is being used, only then the costs increases. Otherwise, for a routine surgeries, it is very much comparable to the open surgery.
Right. So, if the cost of consumables is higher, then it would go up. Otherwise, it.
Otherwise, it's very much comparable.
Right. So, you, of course, are in the NCR region in Faridabad, but what is the penetration of these kind of surgeries in tier 2 and tier 3 cities?
Okay, yeah, it's good you have asked this question. So, being in NCR or in a bigger metro city, these surgeries are available even at a smaller setup also, small nursing homes and all. In periphery, definitely in rural areas, there is lack of instruments, lack of expertise of doctors for performing these surgeries. But still, I think some basic procedures they are being performed, like simple cholecystectomy, laparoscopic procedures like appendectomy. They are being performed there. But definitely, it will take time for the rural and tier three cities to come to terms with the this laparoscopic, advanced laparoscopic procedures. Like advanced, I mean there are other procedures like hernias we are performing. Like there are some procedures for reflux diseases which are being performed laparoscopically. Some thoracic surgeries we are performing with minimal access techniques. So still it is some time to for these things to reach the rural and the tier three cities.
Right. And what about the learning curve for these surgeries? Is that also keeping back tier 2 and tier 3 cities then?
Definitely. The surgeon and the anesthetist and the setup needs to be accustomed to these things. You have to have some training in performing these procedures. But now the PG courses which are being there, so everywhere, most of the places, basic laparoscopic surgery is being performed. But you have to have resources and training to perform these procedures.
Right, right. So, if I am going in for surgery and I need to take this decision, what kind of surgery, what are the kind of questions that I should be asking my surgeon?
Okay. First of all, the like say if you are being if you have visited a doctor for say gallbladder stone, basic, it's a very common disease and most commonly performed procedures nowadays. So you have first of all the center for where you are being operated and the surgeon. Definitely, you have to see whether the surgeon is experienced enough and he has been performing these procedures in the past as well. And the center, whether all the facilities for performing these type of procedures are there, like setup for a general anesthesia is there, and the rest of the things, I guess, anesthesia part is also there. You have to have like pre-anesthetic checkup has to be there, whether you are fit enough to undergo the procedure, and whether laparoscopic surgery is safe for you or not.
Right. So, you have talked about all the benefits of this kind of surgery, but there must be some kind of cons also that one must be careful about. So, what are those?
See, like in some cases, like in old age patients or with the, I have already talked about this before, where the risk of general anesthesia and as per laparoscopic surgery is more, like we have to insufflate the abdomen with the carbon dioxide gas. So if the risk is there, like patient has poor respiratory reserve or he has poor cardiac function, those patients are at high risk. And the patients who have means they are not fit for a general anesthesia per se, these patients need to be assessed properly. And definitely if still they insist for laparoscopic surgeries, that has to be performed with the consent of conversion to open if there is some means issue during the surgery. And again, like previously, multiple surgeries have been done which have been by open technique in the past. So there are very high chances of intra-abdominal adhesions, which may lead to injuries of bowel or some sort of injuries in the abdomen while performing these surgeries. So we have to be careful about all these things.
Okay, so one of the issues you've highlighted is that if there's been previously open surgery, then tissues might be sticking together and you don't have the space. Besides that, if resurgery is needed, what are the factors that you consider that whether you have laparoscopic or open surgery then?
See, there is always an option of converting the procedure. So we might start with the laparoscopic surgery, and if we are able to proceed laparoscopically, we go ahead laparoscopically. Like patient has been operated a long time back before for some means some open surgery has been performed, and now we are planning to perform laparoscopic cholecystectomy. So we start with the laparoscopic approach. We make
Right.
an incision, enter the abdominal cavity, and then take it from there. If the adhesions are within limits and they can be dissected off laparoscopically, if we are going safely, then we proceed with it. And most of these cases, they go smoothly. We are able to perform these surgeries laparoscopically, but definitely we have to take prior consent with the patient that if we find dense adhesions and there is a risk of injury, then we might convert intraoperatively, like during the surgery, we might convert it to the open technique. So, but definitely with the expertise and the type of instruments and all, we are able to perform most of these procedures safely.
And is the time of surgery also lesser with minimally invasive compared
Definitely.
to?
For some procedures, the time is definitely lesser, like because in open surgeries, we have to first open it up and then we have to close that incision, that bigger incision. That takes time. The intraoperative time for the setup time and all, now they are not much in laparoscopic surgeries. So definitely time has also reduced while performing these surgeries. And patient has to have, means he's not under a general anesthesia for a long time for these
Right,
procedures.
right. So, what does the future for these kind of surgeries look in India?
See, going ahead, these surgeries will become available to should be available to every person, say in tier 2, tier 3 cities, and with time, I think in rural areas also, at least basic laparoscopic surgeries should become available. And now is the time. No, I'll come to that. Now is the time that we are moving to robotic surgeries now. So robotic surgeries, they are a new thing in this, but again, it's just a tool for us. It's a surgeon who performs the surgery, not the robot. Robot is not performing the surgery in robotic surgery. It's not surgeon. Definitely, there are robotic arms which are placed in the patient, but surgeon sits on the system and he moves the instruments. So now is the time we are switching in, say, NCR region and metro cities, the robotic surgeries on the uptrend. But definitely not all surgeries need robotic surgeries. They are for high-end surgeries, not the basic surgeries, because the cost of consumables is definitely higher in robotic surgeries.
Right. So that is the path ahead in India. And how, India, how far behind are we when compared to our Western counterparts, or have we overtaken them because India is this big hub of.
I won't say overtaken that, but definitely we are on the way ahead. Uh, we are able to perform all these surgeries laparoscopically, high-end surgeries. Now they are being performed laparoscopically. Even the renal transplants and all, they are being performed laparoscopically. So definitely we are comparable, but still a long time ahead to overtake them because the periphery and the rural areas and tier 2, tier 3 cities, they are still lagging behind and performing high-end surgeries.
And is this a big factor also in the medical tourism that India has? Are people coming in
Yes,
specifically
yes,
for?
yes. We are comparable, and the costs of the procedures in India per se is very less as compared to, say, US or UK. The cost of these procedures are very high, and in India, the cost is within limits. Definitely, so that's the reason the international patients, the medical tourism is on the rise in India. Most of the patients from like Arab countries, Iraq, and everywhere and even African countries, even our neighboring countries, we are getting those patients. They come here even for basic surgeries, like even for cholecystectomies and hernias, because the costs and the means expertise, it's on the rise in India now.
So finally, Dr. Sardana, for a layman understanding, is there anything more we should know? Is there any other question that you should answer for a layman to understand this?
See, first of all, there is a difference between laser and the laparoscopic surgeries. As I mentioned before, people come to us like they ask, still, laparoscopic surgery is just with small holes. It doesn't mean there is no cut.
Yeah.
There are cuts. Patient tend to misunderstand this fact. They tend to think that there are no cuts in laparoscopic surgeries. So they need to understand the difference between a laparoscopic procedure and a laser procedure. Laser is a different thing. Laser is for some procedures like anorectal disease, as I mentioned, some kidney stones or ureteric stones, and some other diseases. And laparoscopic surgeries or the minimal access surgeries, they involve small cuts. So that point needs to be noted by a layman.
Right.
And the center where they are getting operated and the surgeon and the means definitely anesthetist and all, they need to know about the procedure being performed and type of anesthesia being performed, whether the patient is physically fit to undergo type of procedure which is being recommended. So these points need to be taken into consideration.